Welcome back to the Plastic Surgery Podcast, a podcast where we talk about all things related to plastic surgery. I am Philemon Vianis, and that is Dr. Lambros Vianis to my left. This week, we are going to be sticking with cosmetic surgery, I believe, and we will be discussing cellulite. Is that correct? Cellulite?
That's correct. Cellulite.
Awesome. Okay, so let's just get right into it. What exactly is cellulite?
Well, cellulite is a condition of the skin that causes dimpling in the areas of typically the lower part of the body, like the abdomen, the thighs, the buttock area, but it can also affect areas such as the arms as well. So it's a dimpling that causes some changes in the appearance of the skin. It's very similar to like a orange peel consistency of the skin, and that's because of the structural changes that occur. And it usually affects women.
Right. And does it affect men? Can men get cellulite? Oh, they can't.
Usually, no.
Really? Why is it just for women?
Well, because there's, for some reason, no one really knows why it occurs, but it may be attributed to hormonal differences, structural differences in the skin between a man and a woman.
So 80% of women, this has an effect?
It can occur, it can affect adolescent women and women in adulthood.
It can affect all women?
Yeah, from adolescence and
up to, so yes. By age. And does weight have anything to do with it?
That's a very good question. So you could have a person that is obese and someone who is thinner and slender appearing, and both people could have
have cellulite.
Yes. Obviously,
it is is it considered like a deformity on the skin?
Well, when we talk about deformities, it's the loss of the smooth appearance of the skin. Right. So that's why we would call it a deformity.
Right. And obviously, people do not want this appearing on their skin. So how exactly is it treated?
Okay, so let's talk about the anatomy first. When we look at our tissues, the soft tissues, we look at the skin layer that we see. And then underneath, we have fat tissue. And between the skin and the fat are these fibrous bands. There are these pieces of tissue that are actually made up of collagen. And these bands actually attach the dermis, or the underlying part of the skin, to the muscle. It supports the skin.
Right.
So in a normal situation, or if the patient has a nice smooth contour, the fat tissue and the skin layer are typically flat. But the dimpling occurs when these little fibrous bands actually retract down, and as they pull down on the skin, there are pockets of fat that pooch out from between the little fibrous septa.
Oh, really?
Yeah, so you have this lumpy looking appearance on the skin. So there's this theory that it's some retraction that occurs with those fibrous bands pulling the skin down in areas of the underlying the dermis, and the fat herniating through the skin as well. So it's probably a combination.
And that's how it happens. That's how
that's what you see, as far as if you did looked at it under the microscope.
Right.
That's what you would say.
Oh, and that only happens in women.
Yes.
Really? And then, so how do you remedy that?
So some of the remedies have in the past used massage therapy, or moving the skin across the musculoskeletal area. That may have improved the appearance of the skin temporarily, but then it would recur again because those fibrous bands would tighten back down again. So that was sort of the beginning of treatment modalities that were available for patients. Some other modalities that have come out, there are topicals. There are the methylxanthines, which is a class of drugs such as caffeine that theoretically or hypothetically reduce the amount of fat tissue under your skin, and that's never been proven to occur, right? Retinoids,
so drinking coffee isn't going to remove your cellulite.
Exactly right. But the topicals, there are topical agents that they.
So
they
topical
that
meaning
contain,
it's like cream.
Yeah, right.
Okay.
They have that class of drug, methylxanthines that you
can
put on.
That hasn't been proven to work?
No.
Oh, really?
No. Then there are retinoids, which is like Retin-A, that's used for skin conditions, and that apparently thickens the skin underneath. It causes some inflammation, and that thickening of the skin can help hide some of the cellulite, but again, hasn't really been shown to improve the cellulite. So, but there are topicals out there that people can get
Retin-A is used for acne, right?
Exactly right. It can be used for acne, but one of the side effects is that it could potentially thicken the skin, and then by tightening the skin, it could potentially make the skin smoother. Right? Exactly. So then we move to other modalities such as those that are energy based, and anytime you put any type of energy to tissues, it can cause inflammation. So one of the treatments that has been used are lasers. Lasers have been used on the skin to help treat cellulite, but again, that hasn't really been shown to improve it. Right, exactly. Really? However, there are some lasers that have been used that you can put a filament underneath the skin, and that can help affect those fibrous bands that we were talking about that's between the skin and the muscle, and that can loosen those up and maybe break some of those fibrous bands and allow the skin to be less retracted in those areas, and therefore get rid of the dimpling that's occurred from the point. Really? So that's one of that's a treatment modality, but again, it's a temporary improvement for patients. There's radiofrequency that's applied over the skin. Again, you have some energy that's transmitted, probably causes some inflammation, and some people have noticed some improvement, but
that's temporary. That's temporary too, right?
Exactly. But also radiofrequency has also been used with other modalities too, like laser and suction, massaging tissues, and that combination between the several different types of energies that are put into the skin has improved the treatments. And then there are acoustic waves. That's like a shock wave to the skin.
Really?
Yeah, exactly. That they've used.
Are the purpose of these just to cause inflammation?
Pretty much.
Really?
Pretty much, right. Because the inflammatory, once the inflammatory response is triggered, what happens is that there's remodeling of the collagen, which is those fibrous bands and the skin.
Right.
So the skin may get a bit tighter just after it gets swollen from the inflammation, and it may get a bit thicker, and it could make it flatten out. It can break up those little fibrous attachments that are holding the skin down. And so that those energy waves that are put in there, where they're the radiofrequency, the laser, the shock waves, all those modalities do trigger to some degree the inflammatory response, and therefore you're getting some remodeling of the collagen underneath.
So it can lead to permanent improvement.
Well, nothing has been shown scientifically that it can lead to permanent improvement.
Really?
Right. Exactly.
So
you can get maybe a
temporary.
you can get a temporary improvement with it. And there's also the other targeted treatment of procedure called a subcision. Subcision is a procedure that basically breaks up those little fibrous bands that are holding the skin down. And that could be done with a needle that's put under the skin layer, and it's waved back and forth like in a fanning type of method, and that shears those little fibrous bands.
Is that detrimental in any way?
It can cause initially it could cause bleeding or bruising and pain.
Right. That's why I imagine. Right? Yeah.
So that's why it would have to be done under some type of local anesthetic when you do it. Now there is a device that has been used more recently, and it's a little bit more precise in that it has like a suction and it pulls the skin up, and then it has like a little plastic guided platform where the needle is placed through there, and it's moved back and forth, and that gives you a more even sweep of the needle underneath the skin to help break those little fibrous bands. And that treatment has been shown that patients have gotten some improvement over the course of maybe up to 2 years.
Really?
Right.
And then it comes back again.
And then because what happens is that once you release those bands, scar forms again, and it pulls it right back down again.
But long-term effect though of doing that. Obviously, it's not good to have scar tissue in your body at any place. So can that lead to something more detrimental in the future?
Nothing has really been shown to become more detrimental from these treatments. Other types of injectables have been used as well underneath the skin. Those fibrous bands that we talked about are made of collagen, and they do have enzymes called collagenase that can be injected under the tissues, and that could actually destroy some of the collagen or lyse the collagen so that it releases it. So it would be more like a biologic release of of those collagen fibers through an injectable.
What is the lifetime of that? Is that like short term still?
Again, that's in the process of being investigated.
Oh,
at
really?
This point. It's more investigational, right?
There hasn't been anything proven that would permanently solve cellulite.
Not at this point. There aren't any treatment modalities that would be a permanent solution.
Does liposuction help at all?
No, it can make it worse.
Really?
Right, because the tenting that occurs, or the pulling of the skin downward, the liposuction, by taking more fat out from those pockets of tissue, can create a worsening effect, because now that space that was between the skin and the fat tissue has been lowered. Those fibrous bands contract down even more and cause a worsening of the dimpling. Yes.
So more depression.
Right.
Really?
Exactly.
Wow.
So.
Okay, awesome. Well, I think that's all for the Plastic Surgery Podcast this week. We will be back next week again. Thank you guys for watching, and have a wonderful week.